when it passed this statute, did make findings about why it thought it could regulate the commerce here. And it justified the mandate as a regulation of the economic decision to forego the purchase of health insurance. That is a theory without any limiting principle.
Do you accept the General's position that you have conceded that Congress could say, if you're going to consume health services, you have to pay by way of insurance?
That's right, Justice Sotomayor. We say, consistent with 220 years of this Court's jurisprudence, that if you regulate the point of sale, you regulate commerce, that's within Congress's commerce power.
All right. So what do you do with the impossibility of buying insurance at the point of consumption? Virtually, you force insurance companies to sell it to you?
Well, Justice, I think there's 2 points to make on that. One is, a lot of the discussion this morning so far has proceeded on the assumption that the only thing that's at issue here is emergency room visits, and the only thing that's being imposed is catastrophic care coverage. But as the Chief Justice indicated earlier, a lot of the insurance that's being covered is for ordinary preventive care, ordinary office visits, and those are the kind of things that one can predict. So there's a big part of the market that's regulated here that wouldn't pose the problem that you're suggesting. But even as to emergency room visits, it certainly would be possible to regulate at that point. You could simply say, through some sort of mandate on the insurance companies, you have to provide people that come in. This will be a high-risk pool, and maybe you'll have to share it amongst yourself or something. But people simply have to sign up at that point, and that would be regulating at the point of sale.
Well, Mr. Clark, now it seems as though you're just talking about a matter of timing, that Congress can regulate the transaction, and the question is, when does it make best sense to regulate that transaction? And Congress surely has it within its authority to decide, rather than at the point of sale, given an insurance-based mechanism, it makes sense to regulate it earlier. It's just a matter of timing.
Well, Justice Kagan, we don't think it's a matter of timing alone, and we think it has very significant substantive effects. Because if Congress tried to regulate at the point of sale, the one group that it wouldn't capture at all are the people who don't want to purchase health insurance and also have no plans of using health care services in the near term. And Congress very much wanted to capture those people. I mean, those people are essentially the golden geese that pay for the entire lowering of the premium.
Is the government's argument this, and maybe I won't state it accurately, it is true that the non-insured young adult is, in fact, an actuarial reality insofar as our allocation of health services, insofar as the way health insurance companies figure risks. That person who's sitting at home in his or her living room doing nothing is an actuarial reality that can and must be measured for health service purposes. Is that their argument?
Well, I don't know, Justice Kennedy, but if it is, I think there's at least 2 problems with it. One is, as Justice Alito's question suggested earlier, I mean, somebody who's not in the insurance market is sort of irrelevant as an actuarial risk. I mean, we could look at the people not in the insurance market, and what we'd find is that they're relatively young, relatively healthy, and they would have a certain pool of actuarial risks that would actually lead to lower premiums. The people that would be captured by guaranteed rating and community issue, guaranteed issue and community rating, would presumably have a higher risk profile, and there would be higher premiums. And one of the things Congress sought to accomplish here was to force individuals into the insurance market to subsidize those that are already in it to lower the rates. And that's just not my speculation. That's finding I at 43A of the government's brief that has the statute, and that's one of the clear findings.
Doesn't that work the way Social Security does? Let me put it this way. Congress in the 30s saw a real problem of people needing to have old age and survivors insurance. And yes, they did it through a tax, but they said everybody's got to be in it, because if we don't have the healthy in it, there's not going to be the money to pay for the ones who become old or disabled or widowed. So they required everyone to contribute. There was a big fuss about that in the beginning, because a lot of people said, maybe some people still do today, I could do much better if the government left me alone. I'd go into the private market, I'd buy an annuity, I'd make a great investment, and they're forcing me to pay for this Social Security that I don't want. But That's constitutional. So if Congress could see this as a problem when we need to have a group that will subsidize the ones who are going to get the benefits, it seems to me you're saying the only way that could be done is if the government does it itself. It can't involve the private market. It can't involve the private insurers. If it wants to do this, Social Security is its model. Government has to be a government takeover. We can't have the insurance industry in it. Is that your position?
No, I don't think it is, Justice Ginsburg. I think there are other options that are available. The most straightforward one would be to figure out what amount of subsidy to the insurance industry is necessary to pay for guaranteed issue and community rating. And once we calculate the amount of that subsidy, we could have a tax that's spread generally through everybody to raise the revenue to pay for that subsidy. That's the way we pay for most subsidies.
Could we have an exemption? Could the government say everybody pays a share health care responsibility payment to offset all the money that we're forced to spend on health care, we the government? But anybody who has an insurance policy is exempt from that tax. Could the government do that?
The government might be able to do that. I think it might raise some issues about whether or not that would be a valid exercise of the taxing power. And
under what theory wouldn't it be?
Well, I do think that
we get tax credits for having solar-powered homes. We get tax credits for using fuel-efficient cars. Why couldn't we get a tax credit for having health insurance and saving the government from caring for us?
Well, I think it would depend a little bit on how it was formulated, but my concern would be, the constitutional concern would be that it would just be a disguised, impermissible direct tax. And I do think, I don't want to suggest we get to the taxing power too soon, but I do think it's worth realizing that the taxing power is limited in the ability to impose direct taxes. And the one thing I think the framers would have clearly identified as a direct tax is a tax on not having something. I mean, the framing generation was divided over whether a tax on carriages was a direct tax or not. Hamilton thought that was an indirect tax. Madison thought it was a direct tax. I have little doubt that both of them would agree that a tax on not having a carriage would have clearly been a direct tax. I also think they would have thought it clearly wasn't a valid regulation of the market in carriages. And, if you look at Hilton against the United States, that's this Court's first direct tax.
Let me ask, can I go back for a step? Because I don't want to get into a discussion of whether this is a good bill or not. Some people think it's going to save a lot of money. Some people think it won't. So I'm focusing just on the Commerce Clause, not on the Due Process Clause, the Commerce Clause. And I look back into history, and I think if we look back into history, we see sometimes Congress can create commerce out of nothing. That's the National Bank, which was created out of nothing to create other commerce out of nothing. I look back into history, and I see it seems pretty clear that if there are substantial effects on interstate commerce, Congress can act. And I look at the person who's growing marijuana in her house, or I look at the farmer who's growing wheat for home consumption. This seems to have more substantial effects. Is this commerce? Well, it seems to me more commerce than marijuana. Is it, in fact, regulation? Well, why not? If creating the bank is, why isn't this? And then you say, but one thing here out of all those things is different. And that is you're making somebody do something. I say, hey, can't Congress make people drive faster than 40 miles an hour on a road? Didn't they make that man in growing his own wheat go out into the market and buy other wheat for his cows? Didn't they make if she married somebody who had marijuana in her basement, wouldn't she have to go and get rid of it? Affirmative action? Where does this distinction come from? It sounds like sometimes you can and sometimes you can't. So what is argued here is there is a large group of but what about a person that we discover that there are a disease is sweeping the United States, and 40 million people are susceptible, of whom 10 million will die? Can't the federal government say all 40 million get inoculation? So here we have a group of 40 million. And 57% of those people visit emergency care or other care which we're paying for. And 22% of those pay more than $100,000 for that. And Congress says they're in the midst of this big thing. We just want to rationalize this system they're already in. So there, you got the whole argument. And I would like you to tell me, looking
Answer
back
those
at the
questions in inverse order.
No, it's one question. It's looking back at that history. The thing I can see that you say to some people, go buy, why does that make a difference in terms of the Commerce Clause?
Well, Justice Breyer, let me start at the beginning of your question with McCullough. McCullough was not a commerce power case.
It was both?
It was not, no, the bank was not justified and the corporation was not justified as an exercise of the commerce power. So that is not a case that says that it's okay to conjure up the bank as an exercise of the commerce power. And what, of course, the Court didn't say, and I think the Court would have had a very different reaction to, is, we're not just going to have the bank, because that would be necessary and proper. We're going to force the citizenry to put all their money in the bank, because if we do that, then we know the Bank of the United States will be secure. I think the framers would have identified the difference between those two scenarios, and I don't think that the great Chief Justice would have said that forcing people to put their deposits in the Bank of the United States was necessary and proper. Now, if you look through all the cases you mentioned, I do not think you will find a case like this. And I think it's telling that you won't. I mean, the regulation of the wheat market in Wickard against Filburn, all this effort to address the supply side and what producers could do, what Congress was trying to do was support the price of wheat. It would have been much more efficient to just make everybody in America buy 10 loaves of bread. That would have had a much more direct effect on the price of wheat in the prevailing market. But we didn't do that. We didn't say, when we had problems in the automobile industry, that we're not just going to give you incentives, not just cash for clunkers. We're going to actually have everybody over $100,000 has to buy a new car.
Well, Mr. Clement, the key to the government's argument to the contrary is that everybody is in this market. It's all right to regulate Wickard against Filburn because that's a particular market in which the farmer had been participating. Everybody is in this market, so that makes it very different than the market for cars or the other hypotheticals that you came up with. And all they're regulating is how you pay for it.
Well, with respect, Mr. Chief Justice, I suppose the first thing you have to say is what market are we talking about? Because the government, this statute undeniably operates in the health care insurance market. And the government can't say that everybody's in that market. The whole problem is that everybody's not in that market, and they want to make everybody get into that.
Well, doesn't that seem a little bit, Mr. Clement, cutting the baloney thin? I mean, health insurance exists only for the purpose of financing health care. The two are inextricably interlinked. We don't get insurance so that we can stare at our insurance certificate. We get it so that we can go and access health care.
Well, Justice Kagan, I'm not sure that's right. I think what health insurance does, and what all insurance does, is it allows you to diversify risk. And so it's not just a matter of I'm paying now instead of paying later. That's credit. Insurance is different than credit. Insurance guarantees you an upfront, locked-in payment, and you won't have to pay any more than that, even if you incur much greater expenses. And in every other market that I know of for insurance, we let people basically make the decision whether they're relatively risk-averse, whether they're relatively non-risk-averse, and they can make the judgment.
Well, we don't in car insurance, meaning we tell people, buy car, not we, the states do, although I'll ask you the question, do you think that if some states decided not to impose an insurance requirement, that the federal government would be without power to legislate and require every individual to buy car insurance?